Hello and welcome to another video. In this video I'm going to try to cover the aspects of this OSCE station called low back pain. This is a very common OSCE station and let's get straight into it. So the first thing, you want to approach any type of pain type of station with exploring symptoms, which is through Socrates. Socrates is an acronym which is used to explore symptoms. So obviously the first thing you want to start with is the site. In this case, the site is obviously the back, or in this case, lower back. Onset. So when did it start? Was it sudden? And what were they doing? Or was it a chronic or slow onset? Very important. We'll talk about the main red flags and differentials down the line in this video. How does the pain feel like? Is it like a sharp sensation? Burning sensation? An ache? This is very important. You start to classify this type of question. Does the pain radiate? So radiation. I always ask, does this go to your leg? Any leg pain? Just to improve your differential. So let's go to the associated symptoms. Now you want to be quite specific if you want to know exactly what is going. So is the back pain, most of the time the patient will say that it's a sciatica type pain. So it's like a numbing sensation kind of pain. It's also important you ask about stiffness. This allows you to distinguish between a rheumatological type pain or like a general mechanical or MSK type pain. Obviously you want to ask the more specific, let's move this to the left. You want to ask more questions about something more specific, like incontinence. That could be of feces or bladder. And neurological type symptoms, again, numbness. Or let's add loss of sensation. Obviously, this is quite a detailed question, but it's important you kind of like ascertain if there's anything like that. But obviously, depending on how the station look like, you have to know what you're gonna do. Okay, so is the pain constant? That's a T for timing. Does it ever go away? So shall we say pain-free? Okay, or is it better when lying down or resting? Okay. Obviously similar to what we are exacerbating factors or relieving factors. So again, is it worse walking or better? So let's say better when resting. So you just want to have an idea what may be going on in that sense. And obviously you want to understand how severe the pain is. So let's say, how bad is the pain? And obviously you want to say 1 to 10, 100. 1 to 10, 10 being the worst, and let the patient score it for you. Once you've gone through Socrates, as you can see, it's quite easy to go through Socrates when you're quite comfortable with it. You have an idea, you should have an idea what may be going on. Okay, now let's go straight into the red flags, then we can discuss the least dangerous or worrisome symptoms. When it comes to low back pain, obviously the main red flag is your coda equina. I hope I say it right. Coda equina. Okay, so the main the main symptoms, the main differential will be incontinence. That could be of bladder or urine, or sometimes also retention. Another common symptoms could be what we call saddle anesthesia. Saddle anesthesia, which comes from the word itself, loss of sensation of the lower limbs, or paresthesia. So sometimes you may have a patient presented with those symptoms, and obviously this is a medical emergency. The patient might also have bilateral leg pain or leg weakness. So bilateral leg pain or weakness. This could be one of the differential if you don't really have any other differential to present. Another important differential for lower back pain is cancer. Okay, this will be either your, let's say, age range, a patient less than 20, or over the age of 50 years. Okay, and they will present with non-specific type back pain, and the onset could be gradual. I would say slow onset, and obviously you have your classic cancer type symptoms, which is weight loss, okay, night sweats, and continuous illnesses. So I would say recurrent illness. Those are quite important symptoms that you may start thinking. The patient may have a background already of previous cancers, of another cancer, let's say. Okay, so this obviously you need to investigate this type of presentation accordingly. But in the OSCE scenarios, at this point you will have that as a differential. Obviously, we can't forget our spinal fractures. Spinal fracture. Obviously, this is like a sudden onset pain after like a trauma, a fall usually, or trauma. That could be like a motor accident or anything like that. So this is quite straightforward. Normally it's like a severe type pain. So let's just say severe pain. Okay, so this is quite simple red flag in that sense. So let's quickly cover maybe like a common cause for lower back pain. Something not necessarily a red flag. Just kind of like open a small point. The most common presentation of lower back pain is MSK, musculoskeletal. This can be like a acute onset. Obviously that could be due after like a lifting of like a sprain, so after like a back pain or something, after mild exercise, or lifting an object, something like that. I don't, it could be anything. and the pain is quite not severe but painful. Like the patient notice the pain. This pain is mostly around the paraspinal muscles, okay, muscles of the back, obviously, rarely the central. And that is your main MSK type symptoms, which obviously you should know how to manage them as a physician associate or as a junior doctor. Another quite important common presentation is like lumbar arthritis. Let's say arthritis of the back. So this is like a chronic back pain, worse when standing and better when resting. So you're not too concerned with that. And the patient will, from the history, you gather that the stiffness is getting worse. So progressive stiff back or lower back, something like that. So after you've gathered this information, obviously within the time frame that is permitted in your OSCE, that could be 10 or 8 minutes, you should have an idea what may be going on if you're taking a good history. And at this point, you have to quickly go through, obviously, past medical history, very important. Family history, very important. Any history of lower back pain, lower back, spinal cancers, stuff like that, any spinal surgery, anything around those lines. Drug history, obviously, check for allergies, very important, especially in the OSCE station. Social history. This is quite important because I tend to ask about occupation. Let's say occupation. Obviously, if the person do like a lot of lifting jobs, so this is caused by is probably a musculoskeletal type pain. If it's progressive, arthritis, and if the patient have a history of arthritis, it's just like a continuous perpetual cause of low back pain. Okay, and ICE, obviously intention, concerns and expectations. So I'd still ask it in my practice today because it gives you an idea of what the patient's idea of what the care they should have, and you can come into a common place together to provide the appropriate type of care that you think the patient will need at that moment. I think that's it in regards to lower back pain. Very easy, not too complicated. If you get an MSK or a basic back pain in your OSCE, you should ace it, and that's a free station for you to pass. Great. I hope you guys enjoyed this video as much as I did. Don't forget to like, subscribe to this channel for more content, and I'll see you guys in the next one. Goodbye.